So, how you doing, everyone? You good? Yeah? Everyone's tired. Tired. So we're going to go on to the Q&A section for the master trainers. And we've got about 7 questions to go through. We need to keep this fairly short, otherwise it could drift on till the early hours of the morning. So, first question is, patients with leukemia or myelomatosis producing more cancer cells, immature cells, when we work with them, repair phase, are there any experience that these clients ever get well after some treatment? Yeah. So patients with leukemia or myelomatosis, and it says producing more cancer cells or immature cells when we work with them, and it says in repair phase, are there any experiences that these clients get well after some treatments? Yeah. Who asked this? Who asked this question? Okay. Yeah. Okay.
Yes, lots. And we have to remember that this is second phase. This is in the regeneration. So sometimes when I'm working with clients, we'll see the cells actually building up even more. But that's for us to keep the client safe and say that the cells are building up more. And they may have a healing peak in the middle. And then the part B is when they'll start to recede again. But not to be afraid that the cells are multiplying even faster, which can happen if we're working on them. And if we work too quickly, then we're pushing them too fast. And we have to be aware of their vitality and what diets they're on and who their support network is. And I've also worked with osteoporosis clients that have gone into leukemia. And so we have to be aware how to handle clients and guide them and take that fear away. But I've worked with about 25 clients now that have healed themselves. And I'll reiterate that, healed themselves. Does that answer? Oh.
Thank you.
Sorry.
Okay, ich muss halt übersetzen. Wer übersetzt? Oh, da brauchst du ein Mikrofon, okay. Es stimmt schon, dass Leukämie in der zweiten Phase vorhanden ist.
It's correct that leukemia appears in the second phase.
Aber da es ja die zweite Phase auch Energie kostet.
And the second phase is an energy consuming process.
Und wenn ich zu lange brauche, um Zellen aufzubauen, die mir den Sauerstoff transportieren, die mich am Leben halten können, dann sterbe ich, wenn es zu lange geht.
And if it takes too long time to rebuild the cells that carry the oxygen and are not energetic enough, then I might die. The person can die.
Und vor allen Dingen, die meisten Patienten, die kommen ja von der Schulmedizin und haben immer im Hintergrund die Angstenergie.
And most of the clients come from traditional medicine, so they are still full of fear.
Die Nahrung, die spielt schon eine Rolle.
Nutrition is important.
Aber
No, it isn't. One thing I would like to say, what usually also complicates this is that people who has leukemia often are in at a school medicine treatment program. And that really makes it really difficult and challenging to work with these types of clients. So you just have to take each client for themselves, talk to your trainer, talk to your master trainer, talk to your colleagues, and we all have to work together to solve these problems.
Okay.
Traditional medicine.
It's not traditional.
No.
Modern medicine. Modern medicine.
Yes. Okay. Yes.
The traditional doctor.
The medicine trained at universities.
Chris, can we have a lapel mic for the audience? Thanks.
And another thing to remember is these patients who have leukemia in particular come from a conflict base of extremely deep self-devaluation, because this is the deepest possible in the bone. So in our experience with a few of the clients, if this conflict of self-devaluation is not worked completely, it is possible to have the patient go in remission because they would have a lot of triggers in their environment, in their life, people who they meet, which can either prolong the process very much and the patient goes on and off. So this is very, very important to work with and coach them for their self-esteem and really discover what triggered that deep self-devaluation.
Oh, sorry.
Ja, du darfst übersetzen. Simpsons. Was Diane gesagt hat, war der wichtige Punkt. So ein Patient benötigt tägliche Zuwendung.
What Diana said is very, very, very important. A client who's got such a process needs daily assistance, daily support.
Ich habe eine Patientin, da habe ich über 2 Wochen lang jeden Abend nach der normalen Sprechstunde 2 Stunden mit ihr verbracht, mit ihr gesprochen, ihr Vertrauen gegeben und die hat überlebt.
Anton is a very altruistic medical doctor trained at the university. He had such a client. He had such a client, and every day after he finished his work,